me start again with this. Thank you, Madam Chairman. And let me just kind of remind people about this. The Trump administration was listening during last spring as this thing was unfolding. So despite all this unrelenting criticism that's unfounded, the Trump administration actually ordered 1 billion vaccines from the 5 companies that are represented here today. 1 billion. That's enough to vaccinate every American and then some across America. And now, Chairman DeGette brought up a good point, but she said very clearly in her opening remarks, but the rollout has been slow. So my question back, we've heard from Dr. Nettle, I'm curious from Dr. Hogue, did you explain or maybe give me some insight from your perspective, does the international supply chain impact the base of manufacturing of the vaccine from your perspective, Dr. Hogue?
No, sir, it doesn't. We have a completely separate supply chain that we've established in the United States in partnership with the federal government, and they are completely separate. And all of the U.S. supply chain is delivering for the U.S. government.
Okay, thank you. Let me switch gears here substantially. Last year during 2020, we had about 400,000 people die from COVID across the country. But at the same time, we had over 80,000 people die from substance abuse. Now, that's a horrible number to think about, 480,000 people dying unnecessarily. But and the ratio is 5 to 1 between deaths of drug overdose and COVID. But the American government has made an absolute commitment, and I'm proud. But they're spending 750 times the amount of money to deal with COVID as they are on substance abuse. Even though the ratio is only 5 to 1, or is 5 to 1, it's 750. So, and we also know, according to Johns Hopkins, it just came out with their study that said the 7-day rolling average for daily deaths has actually been decreasing in America during this period of time. So, but at the same time, drug overdoses have not been. They're continuing to rise. Vivitrol has been a proven treatment. We know about that. Numbers of you know that's a competing product, but the supply and demand has made it difficult to get. So thank you for stepping up to work when we needed you for COVID, the developing a vaccine. But I want to know whether any of you is equally committed to solving this substance abuse problem, getting us a treatment, the equivalent of a Vivitrol, that we might be able to deal with it. Because, as I said, the COVID is going to go away, but not the drug abuse. So any of you want to chip in and say your companies are doing something on that?
Apparently, John Young from Pfizer here. Let me thank you for the question. One of the things that I would say is that we manufacture naloxone, injectable naloxone, which is an antidote to certain opioids that can cause, death and have serious effects. We work very closely with the federal government to make sure that we continue to supply that to states and emergency.
I'm aware of that. If I could reclaim my comment, I'm aware that you're doing, several of you are doing something, but I'm trying to stop it from the beginning, not treat it after the effect. So let me flip back to the COVID issue. You all began at the beginning when Chairman Pallone he opened up the testimony by trashing President Trump, former President Trump, and the Biden administration has been calling for unity, but the rhetoric has not been matched the words. The president has actually said there's been no distribution plan, and the vice president said that the cupboard was bare when they took office. They were starting from scratch. Well, quite frankly, the cupboard should be bare. It's not meant to be on shelves in Washington, but in people's arms. So if there was no distribution plan that they're alleging, how did over 60 million doses get out to the public? And for us in West Virginia, we're now at a rate, we're nearly 20% of the population of West Virginia has gotten at least one shot, and 10% has been fully vaccinated. So I don't know how this happens without a plan. So Dr. Nettle, you put you on the spot here. Do you agree with President Biden that there was no plan, and with Vice President that the cupboards were bare?
What I can say is that J&J very much appreciates the collaboration we've had and we continue to have with the federal government. It has certainly been an important contributor to allow us to move forward at the pace we have to potentially bring forward a vaccine that's under consideration for emergency use this week.
Thank the gentleman.
Yeah,
Chair-
yield back my time on that. Thank